healthcare insurance, you have to use
So that's for the Pledge of Allegiance. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. On the Texas flag, I pledge allegiance to thee, Texas, one state, under God, one and indivisible.
Meeting will please come to order. We do have proof of posting in accordance with Chapter 5.1 of the Texas Government Code as amended known as the Texas Open Meetings Act. Any members of the public who wish to speak should each have 5 minutes to voice support. Anyone? If not, we'll go to item number 1 to approve the minutes of the February 27th regular meeting.
It's all good.
Anything on the minutes?
Make a motion, we accept the minutes.
All in favor? Aye.
February 27th.
Motion carried. Item number 2, budget transfers and amendments.
Judge, there's no transfer, but there's one budget amendment, and it's for the $500 donation to senior services for Community National Bank and Trust.
We do have to change.
It's already deposited.
All right. Do we have a motion to approve?
Motion to approve the budget transfers and amendments.
All in favor? Aye. Any opposed? No. Motion carried. Item number 4, payrolls. Bills. Approve pay bills.
So I'm not sure what page that is. Attorney fees.
It's 542 or something like in there. Not page number, but part number.
That's the 77th district. Yes.
On page 7, is that where you're What's the number over here?
Oh, yes, see, here's 6, 5.
542. 542 is county court. No, 77. Right. 42 is 77.
It's indigent defense.
If a person cannot afford an attorney, then they can request a court-appointed attorney, and if they fill out an application and they qualify under the guidelines, then the county appoints an attorney for them, and the county pays that fee. Now, when they plead, that fee is assessed to that defendant, and they pay that back money.
So do fees change? Do fees change? Do they go up and down?
No, it's a base fee. For example, when this is district court, and the base fee is $500 for the case, if it's a plea. If it's if they go to trial, of course, it's a different schedule. If there's more than one case, then they get a little additional fee, not much.
Let me ask you about the one in the sheriff's department. I see we spent $15,813 570. And that's on medical.
570, that's health insurance.
Okay, this is health insurance.
It seems like we go through these pretty quick, but the auditor's office is gracious enough to provide those to us early, so we have them in their packet so they can look at them ahead of time. We can look at them.
Do we have the courtroom, where would I find it? Where are we in the courtroom? Are we finished with the courtroom? Have we paid?
There are a few things that are left for them to do, a couple of changes, but we're basically finished and we have paid all but the retainage amount.
Okay. When I talked to the contractor one time, he said that he thought that we were going to come under budget. Did we come under budget? Where were we on that?
Well, he's not told us that, the amount. He had mentioned that to me previously too, but I'm not seeing that. But we are having to make a few adjustments. The plugs were not under the tables, and that's a hazard of people walking around tripping on those cords, so they're going to move those back. Also, the district judge did not think that the witness could be seen by the attorneys on that opposite side, so we're going to raise the witness chair and the other one on the other side. And just, a few minor things that were changed and like that he's requested.
So is it going to cost us more money or,
I don't think so, and it may be using up some of that overage that we thought we might have, but, and then we are going to still be talking about the light situation. It's dark, and so they're going to have to do some changes there to make it, to where the working situation up there will be better as far as lighting. All back right. Any opposed? None motion carried. Now, we payroll running. All right, we'll go to item number 5, reports. Have a report from county clerk for the month of February, from JP3 for February. New form for the county clerk.
Yes, ma'am, it is.
With your new system. Is everything working now well?
We are pretty much up to par. We did have a little issue of them not breaking out, they are breaking out our birth certificates where the auditor's not used to that, and we're working with them still. We thought it was fixed. She brought it to us today, and it's glitched back to where it's not, so that's, other than that, it seems to be going well.
all the election stuff seems like it's going to be working with?
We do not have an election until November, so we have not had to address any of those. They still have to come back and redo the plugs and fix the poll books for us. And since other people are having elections, they put us on the back burner for who needs them first.
Yes. We have a monthly report for, I'm sorry.
There'll be some elections in May school boards and.
We have not been asked to hold anybody's elections, which we can't hold. I don't hold the elections,
No, but
but
machines.
they've not asked to rent them. They've not asked to rent them. The school had called about renting our stuff. They're not having elections. They're the only ones that has inquired about it. So no, we're not
I think
being
there's
asked.
some schools that will have elections.
We've been notified that the city of Fairfield, city of Tig, and the hospital districts having elections. I've been notified of that.
We have a monthly report for February from the tax office, from the extension service. We have the treasurer's report based on the monthly financial that was presented last time. And this is one that has to be put on the item number 6, current only. Always look at our firemen out there. Firemen, and we have another one. Yeah. Item number 7, special road use agreements. We got to last time we talked about it. Ready?
Email for me, we'll go and approve these today.
Now, is this for the person who's going to bring $1 million? I think we need to wait till we have the bond.
It's in up there next year.
He's not here.
Okay, well, we'll just, if there are none, we'll go to blue bonds and education certificates. I do have one from Jeannie Keeney for the cybersecurity awareness training. Was that a good training?
It was online, so it was no cost for the county.
We can
and,
still do that.
Yes, you can, just sign up, and they'll give you a certificate after each level.
Okay, so you're level 1. Anyone else?
We're going to Top Gun, Andy Bonner.
Andy Bonner?
You should have had one judge for Allison too.
Maybe I just- I do have one for Allison, same thing, cyber security awareness.
And I got one. They got one too from,
Where'd y'all get them at?
they got box.
I don't have proof to get to go in, I have to have an appointment, so I'll get mine after.
You can bring it next time. That tells you something, doesn't it? There you are. We have County Judges and Commissioners Association Education certificates from Andy Bonner. Any others? If not, do we have a motion to accept
I
these?
like a motion to accept.
Second.
All in favor, aye. Motion carried. Item number 9 is the annual review of the Freestone County investment policy. Are there changes to this one from the one we've always had?
Judge, the only changes, we met with TextPool, who is our pool participant, and they have to get a copy of that. And the only change I highlighted on there for you is their recommendation. I think it's like on page 4 or 5, I highlighted it in yellow. They request that part be taken out, and the reason they said that, if we leave it in there, it's not huge, but they just said that that wording is not appropriate because pool does not operate like a mutual fund. So we have to go.
It's on page 7.
It's on page 7.
Be eligible to receive funds from and invest funds on behalf of Freestone County under this chapter, a public funds investment pool.
Just created to function as a money market mutual fund is what they request be taken out because they said by law they do not have to function like
And that's not a requirement of the Investment Act, is it?
He says that they, TextPool, in the paragraph before, you'll see there's some other stuff about money market, which is fine. He said, but a pool does not by law function anything like a money market mutual fund.
With that correction, do we have a motion to approve the Freestone County investment policy?
Well, that correction I approve.
I know previously Kay had sent these to someone for review. I think we need to send that with this change to ensure.
If you want to, we
I
can.
just asked you, I know, we.
I looked back and it was a few years ago that she sent it, yeah, so, it's about $100 cost to, for them to
See if
review
there's
it.
any changes in the law that we aren't aware of
Okay.
that, but you went to that investment
Yes, Karen and I know.
conference, didn't you? And they didn't say there was anything new, is that right? Okay. I think we're good then. Okay. If you do, I'll wait. Perfect. All right, do we have a motion? Do we have a second?
That's it.
All right, all in favor, aye. Motion carried. Item number 10, consider the indigent healthcare solutions as an indigent software provider.
Again, Judge Grant, that's, we do the indigent healthcare between our office and the auditor's office. And we've met with IHS. They're one of the 2 software companies that I've heard of that operate in Texas. You'll have a packet in your thing that shows what counties around us use them currently. And they're here to answer any questions that y'all might have with them. We met with them. We took some of the bills that we paid recently, redacted, not real recent, but prior to them coming, and redacted the information and sent them to them just to kind of see, you know, based on what we were doing, where we would fit in. And we have a spreadsheet there that just kind of shows, you know, what, if we were with them and versus. There's been some changes, so we've learned some things. There were some things that weren't being done fully correct prior to. We've learned those, and the auditor's office is doing a really good job now of, you know, being on top of that and
Do you
making sure.
think, you said you learned some things that made some changes, do you think that was the reason that maybe some of these were not done correctly, and so maybe we don't have that much of an issue?
Again, about probably 4 to 5 months, maybe 5 to 6 months before Kayla, we had found out that we were not doing everything exactly correct in a hospital in Waco had talked to us about it. So prior to that, the county probably was saving a bunch of money because we wasn't doing it at a percentage like we should have been. We were just doing CPT codes. And then after doing that, there's some, again, they could probably answer the questions way more than I can, or even Karen maybe. But there's modifiers and stuff that are involved, and if you don't know what those mean, you're not going to be able to process the billing correctly. And so in that, I think Karen learned what some of those modifiers are, and she probably evaluated them that way better than I could. And so yes, I think now with knowledge, you know, there's things that's going to be, you know, more correct.
Well, I know it's.
There is still a part of
Very
putting someone,
involved, too,
yes,
so
and there's
I'm
still a
not-
part of putting someone on, not just the billing. There's the part of putting someone on the indigent program. And, you know, of course, Kay trained me, and so haven't been to any formal training. You have to go to Austin for that. The department that does that, they only have 2 employees. And so I've asked numerous times, emailed them with them to see if they could send one, since there's like 3 to 4 of us that could utilize that training, and they're just a short-handed office, and they're just like, just can't do it. And so, anyway, that's the speaking with IHS, there's Tanya and Robert, and the cost would be, without the figures in front of me, a little over $900 a month, and
How much a month?
a little over $900 for the first user. It's per user. At first, we were thinking we might have to use 2 users because our offices handle it, but they were kind of assuring us, I mean, that's up to us, but they thought we could definitely just utilize 1 because it's how many users are on the system at the same time.
You did say a month.
Yes, sir.
What is this program going to do for us that we're not doing already?
So it basically does the billing. You put the information in there, and due to their software being able to do those modifiers and all the different things, it's going to tell you how much the charge is based on that. Where right now we look up a fee code.
Not the billing, but what we're gonna pay.
Correct.
That we're gonna pay to them. They send us an invoice that is at their normal rate, and then.
How long is
they
this
do-
period for right here, Judy?
we can pay that percentage.
I have all those bills over here if anybody wishes to look at them. That was approximately 5 to 6 months prior to them coming and meeting with us about a month ago. So it went back about 5 to 6 months. And that wasn't every bill we done. We just randomly in that period picked some.
So the benefit of going with them, okay, so that we can use their software? That's the benefit?
Well, the benefit is to take some of the liability off of us because number one, apparently year, we found out numerous times that things were not being done correctly. Like we had done them because we weren't aware that we were doing it incorrectly. And then also the liability of putting somebody on the program, if they really shouldn't be on the program, or taking somebody, not letting somebody be on the program, but maybe they should, just because of the lack of knowledge, the liability of a person doing it and not having the knowledge of how it truly is supposed to be done.
May I address the board? Hi, I'm Robert Baird. I'm president of IHS. Commissioner, you asked a specific question, and the value of our software really is in 4 primary areas. One is the eligibility, as Jeannie spoke of. There's a tremendous mathematical algorithm the state wants you to go through to determine if somebody is actually eligible to get on your program. While they're doing this in our software, it's checking on fraud to make sure that, in real time, to make sure that the person should get on. So that's the first part.
How do you do that?
Well, we're doing it several ways. We're making sure that the address that they give us is actually in Freestone County. Chapter 61, as you probably know, mandates that a county can only pay $30,000 a year on an indigent patient, or 3 prescriptions a month. You'd be surprised how many people will become eligible on maybe the Liberty County indigent program, and also across the county line in the Hardin County indigent program. So we're checking the database to make sure that they live where they say they are. When they give us a phone number, and most of the people applying for indigent are going to give you an accurate phone number, because if something happens with their medical care, they'd like to know about that. We're checking the AT&T database to make sure that the phone number that they give, they actually own. Why does that matter? If I give you a phone number and the software comes up and says that phone number is actually owed and paid for by Chester Baird, the person doing the eligibility will say, well, Robert, it says here that this phone's being paid for by Chet Baird. Who is that? Well, that's my father. What else is Mr. Baird helping you pay for? That goes to resources, which determines somebody's eligibility or not. As we pay the bills, we're making sure that the bills haven't already been processed. As you know, some of the big medical providers will send us a medical bill, we'll pay it, and next month we'll get the same darn bill again. So we're making sure the county's not double paying. We are checking in real time against the Social Security database to make sure that the individual who's trying to become eligible on the program is actually giving us the proper Social Security information. Those are just some of the examples of what our software is doing behind the scenes. Back to the Commissioner's question. So we have the eligibility part. We have the case management portion of it, which is a big piece of it. We have the bill pay part, which she's already described. Reader's Digest version of that is a bill comes in from the hospital, says you owe $20,000. You run it through our software, says you really only need to pay $4,000 of that. We're licensed by the American Medical Association to have the most current procedure and diagnostic codes in our software. The final part of it, Commissioner, is all the state and county reporting that's HIPAA compliant on how your money's being spent, what you were billed versus what you're paid. We serve 170 counties in this state alone. Populations of less than 1,000, populations of over 1 million, all using the same software. All we do is county government. Don't do any cities, don't do any private industry. A lot of our counties have dedicated indigent healthcare directors who can go to the trainings in Austin and understand what's called Chapter 61. We have a great number of other counties, usually smaller ones like Freestone County, where the indigent healthcare work is done by the 911 administrator or the county auditor or the county treasurer, who all have to go to their own continuing education classes to be the auditor or the treasurer or the 911 coordinator. It's really difficult to keep on top of all the different legislation that mandates health care, especially after the Affordable Care Act. So what our software does is it makes sure that really without being a healthcare expert, that the county is staying in compliance with Chapter 61 simply by answering questions in the software. We don't require any money up front. You pay us like I'm paid every month based on our ability to get the job done. Most software companies will say, if you like our software, cut us this big check on the front end. We don't do that. And in fact, I was going to propose today something that takes all the risk out of trying us. And I don't think there's risk with us at all because we don't ask for any money up front. Every time one of my 170 clients sends me a check, they're saying, okay, IHS, you did good for March. Let's see how you did for April. And if we don't do good, then we're gone. My proposal is this. I understand how counties budget money and that you are in the middle of a current fiscal year yet. And this summer you'll start budget hearings for next fiscal year. My proposal is that IHS will put our software into Freestone County probably in May at no cost whatsoever. Zero. We'll let you use the software for part of May, all of June, all of July, all of August, and all of September. 4 months. And at the beginning of the next fiscal year, if I or the staff here can't come back and show you the return on investment that you're getting more than $945, whatever it is, in value from our software, then we'll simply change the password, and on October 1st, no harm, no foul. So I want to remove 100% of the risk of failure in a small county and put it in here and let you try it. And if it doesn't work, you've not spent a penny on me.
I also wanted to say that once they come and met with us, we discovered that if, right now, I send in the state report, and Limestone County also houses quite a few of our inmates, and they have their software, and they're doing that same thing through their software for us, but neither our county or their county is utilizing those numbers towards this 8%. And I called the state and finally got to talk to somebody this morning that called me back and figured it up. Our 8% is right around a $500,000 number. And I have that. It can be exact. Based on what she told me, well, actually, I'm sorry, it's a $676,392 number to get our 8% of our general tax levy. And so, because we're not getting close to that right now, what that means, if we hit that number, then the state would reimburse us some of that, but we're not utilizing those numbers at Limestone County, and neither is Limestone County utilizing those numbers. So, what they helped us understand was, if we're not taking that out of the indigent fund, then we can't utilize those numbers. And so, even though I've been sending it on a report, because that's how I was trained on the Freestone County part of it, we can't utilize that unless it comes out of the indigent fund. So, and right now our care of prisoners does not come out of the indigent fund, so that is another step of that we may want to look into.
Which will be easy to change, it's just where we code it to.
Correct.
Yeah.
And money.
I would like to tell the court that the law, and many of our clients, the law allows you to pay our fee out of the indigent health care fund. This is not having to find money to pay us, if you wish to consider us, from some other department. The money is there. So you would not have to wait till the new fiscal year. But even knowing that, I'm proposing that the court consider allowing us to put in the software and not start charging you until the new fiscal year, assuming that you see the value for it.
You say out of the indigent health care fund?
Yes, ma'am.
What fund are we talking about?
So under Chapter 61, as the court knows, 8% is to be set aside for the care of the indigent. And I think you said that's on the roundup is about $600,000 a year. Now, Freestone County is never going to get close to spending $600,000 a year on indigent. But that pool of money over there, you're allowed to pay my software fee out of.
So when we submit our costs for indigent care, can we include that?
No, ma'am, that's good, that's a great question. So if you submit your cost, yes, you can. However, if you were to ever spend all $600,000, and if you were to request from the state a refund, you could not count, again, I'm gonna round up, you could not include the $12,000 a year you've paid to me from that. But there's a huge amount difference between the $600,000 Chapter 61 says you should pay and the amount annually that you in fact do pay.
I know we didn't have an actual fund for that, so.
Well, yeah.
Okay. All right, not set aside. Of course, we
Yeah.
fund whatever we have to for
Yes, ma'am.
indigent health care as we go.
Just like many counties.
Yes.
Commissioner Daniels, did I answer your question?
You did real well. I think giving us the opportunity to try your
Yes, sir.
software at no cost to the county to see how it works. I think that's a good selling point. How do you feel about it? You got the opportunity to look at it and everything. And so what do you think about
I do
it?
have one other question. When you say you're gonna see how much we save, what we'll be seeing is the difference between what we would have done as to what y'all are doing with the program? Because we won't be doing it then if we're using your program.
So, great question. I don't want to put words in your mouth, but the treasurer intimated that because when Tanya came in here and is a subject matter expert on indigent health care and did the demonstration, the county learned of things that it should be doing different, that in fact, when you started doing them differently, you had already noticed a significant savings, okay, just because of the learning curve. The rates that are charged by hospitals and doctors are changing all the time on a daily basis, even medications. And so are the rules, especially with the Affordable Care Act. So it is possible, even after Tanya shared her knowledge that made policy changes here that have already paid, I believe, for more than a year of our services, that changes are going to continue to happen, that our software will make sure you're always in compliance. So it is in fact possible that over the next 4 or 5 months of using the software, I'm able to show that you were billed this much and you saved this much. And in that meantime, here are the policies that have changed, that have caused that savings. We have a great number of counties. I have several counties, mostly in West Texas, that will use our software and maybe only pay 2 bills a year. Two a year. Yet they pay us $1,000 a month. Well, why is that? Because of the efficiencies the software brings, and because, in one case, you had 2 prisoners get in a fight in the exercise yard, and those prisoners for specialty care had to be transported to the University Medical Center in Lubbock. And the medical bills for one of those 2 prisoners exceeded $120,000, exceeded 50% of that sheriff's entire budget. And so to be able to use our software and drive that $100,000 medical bill down to $11,000 or $12,000 is basically an insurance policy for them. So if in 4 months you're looking at, okay, we were billed this much, we paid this much, that did not equal the $12,000 a year that you're asking us for, Robert, I don't know that we can meet that threshold or not. But I believe that by keeping you in compliance with Chapter 61, keeping you in compliance with all the rule changes that are continually happening, the efficiencies to run the reports in seconds, and more importantly, the ability to make sure that the people who are trying to get on your program should be on your program I think that has some value. Now, whether it has $12,000 a year worth of value is for the court.
I'm Vance Oglesby, and I was discussing with him prior to the court how you derived a cost. And gentleman's name is, what's your name? Robert. Robert said that they were using the source of the Red Book in the case of drugs. I'm going to sit on the hospital board as well. CMS has a standardized cost. Medicaid, state Medicaid has a defined cost that comes and changes, I believe, daily. Now, they're saying that their source of information or cost for the pharmacy is going to be the Red Book. Well, any pharmacist under 30 years old has never heard of a Red Book. And I haven't subscribed to one in over 15, maybe 10 years. I haven't bought one. They say that they come out on monthly cycles. I can tell you drugs are in a deflationary cycle right now. So the cost of a drug one day, let's just say Advair, if anybody is on the COPD drug Advair, it ran generic. It's now 50% of what it cost a week before last. It was $600, and now it's $200. And so if you're ever going to use a source that comes out every month, and Robert told me that Top 61 required them to use a source of information that is, I don't know, I don't guess it's the Red Book, but nobody uses the Red Book. It's not an accurate source of information. It makes me wonder what kind of source of cost you're going to use for a hospital. I mean, this almost unaffects me. I think we have one indigent patient. And you know, the mentioned $676,000, how much do we actually spend?
That varies depending on how many we have on the program, and as I said, we're not even taking the inmate stuff out of that. So as of right now, you know, I send the form in, so it varies.
Well, just guess, how much did it cost last year? How much did we spend last year? Give us for the last.
30,000?
See, it's not much.
Up in the thousands, but not,
Yeah.
and if you added
So-
the inmate.
I know we transferred money out of what we have.
So if you're using it as an insurance policy as far as determining eligibility and believe that that source of information is the best source of eligibility, well, I mean, that's an option for you. But I would send somebody to Austin to the training seminar and say, what do you recommend? That's what I would do. You know, I'll go to Austin regularly, and most of it unaffects me directly. But, you know, I think I have maybe one customer that's an indigent patient. But you may as well just guess on the cost if you can't roll with the costs that are coming out every day. The Red Book, the day it's printed, it's out of date. And if
Who uses the Red Book?
I don't even know who produces the Red Book.
No, I mean, who uses, do we use the Red Book?
You're gonna use the Red Book now. You use the Red Book.
We used to before we went with Vance we relied on Vance at Hometown Pharmacy, and now we've added TIG, Pharmacy Plus, I believe is the name of it. We've added them on there as a provider. We rely on them to make sure that we're paying the right cost, but prior to that, we did use the Red Book here.
Yeah.
And then if they would do it once a year, they'd buy a Red Book, maybe once a year.
What CMS does, and just for your information, is they receive large rebates from certain companies. One thing that you could do is have a devoted person that gets the indigent person on Medicaid or as soon as possible. If they're deemed worthy of indigent care, they're certainly going to be deemed worthy of Medicaid. And I don't doubt they're doing that. I think they must be based on your really, really low cost. You know, $20,000, congratulations, something good done.
And don't hold me to that number, but it's in that range somewhere. It could be 15, it could be 25 sometime, but it's in that range, I think.
But it seems, what I did is say exclusive of rebates, which usually are almost they're non-existent on brand name drugs. We get rebates on generics, but we just had a cost plus a certain amount. I don't really even, I didn't bring the sheet, but it was not much. But you had somebody named Priscilla here that would bring me the red book, and it would be 2 years old, and said, well, why is it not this price? Well, somebody bought up all the raw powder, and now this drug, it was 50 cents, is $200. You know, it's something that you have to stay on top of. It's not, and right now, again, for the last 2 years, we've been in a deflationary cycle of drug prices. Hospital has, you know, the ICD-9 codes. Those are about procedures and how much they cost. But the payment or the remuneration changes regularly. The ICD-9 codes may not change, and the national drug codes on the drugs may not change. I'm just saying this may not affect me, but I think it's going to affect the county, and I would want something that was correct to be instituted for our county. It wouldn't cost that much for somebody to go get trained, my suggestion. But your drug prices, if you're choosing this as a choice of drug prices, they're going to be wrong.
Well, I think.
I promise.
I don't think it's the drug prices that we have an issue with, it's with the percentage that we're paying, like to the hospitals, because we get a discount on what we pay. I don't know if the discount's the right word, but we only pay a percentage.
Like Freestone Medical Center, we, on a 1450 claim form, we pay, what is it, 14%?
Right.
And then CPT codes on the.
Have you been to see the administrator of the CEO over there? Because they'll negotiate anything you have over there. I don't know what the outcomes will be because I'm just on the board, but I do know that right now we're not ETMC, we're Freestone Medical Center, I think you all know that, but we're owned by the taxpayers, and the hospital wants to work with you as well, so anything is open to negotiation.
Do you have any questions?
I'd like to respond if I'm given permission, and I know y'all have other stuff to do, so I won't take long. Couple points. And your name, sir?
I'm Vance Oglesby.
Thanks, sir. Vance referred to something called ICD-9 codes. ICD-9 codes haven't been around for a couple years now. They're known as ICD-10 diagnostic codes.
Yeah.
Excuse me. Secondly, Vance indicated that it might be good if you had somebody full-time to determine if somebody that was trying to get on the indigent program could get on Medicaid. The state of Texas created the indigent program as an unfunded mandate to be a safety net. Specifically, if you're eligible for Medicaid, you cannot get on the indigent program. So the indigent program was for those people who were so poor they can't even get, or not citizens, they can't get on Medicaid. So that's not going to happen. Regarding going to the state and getting trained, training in the state ended yesterday. We were the only vendor that had an employee actually in the state. Finally, it's called the Red Book Codes. It's owned by IBM. I know of 170 counties in Texas who use those codes and have used those codes, and it passes the audit by the state and county auditors in more counties than it doesn't. So I can't debate the accuracy or not. I do know that about every month 4,000 to 5,000 pricing changes hit. But I know Chapter 61 almost better than anybody in this state. And people use those codes. And again, if this doesn't work out in 4 months, I'll go on back to Conroe and keep doing what I'm doing. But I would like the opportunity for Freestone County to try us out. And I'm willing to fund the risk.
You had asked about our prior expenditures. In 2016, we spent $7,400. 17 was $15,000. But now this does not include
Inmates.
inmates, so we don't know. And then last year we spent about 20. But if we move the inmate, then certainly that would be
Correct.
a lot of, what is
And
it?
I don't know what the inmate, numbers are, so
What number is inmate?
575 care prisoners.
some of that might be
Yeah, we spend a
food
lot
and
more in
stuff
care
too,
of
right,
prisoners.
Karen?
Uh-huh.
In that, so that's not all medical, is that
But she's
correct?
looking at the correct line. I mean,
Okay.
you can look at medical, you know, the,
I did look at just the indigent line,
Mhm.
but the care of prisoners is just an average in the 40s.
Judge Robert, you said that just the changes that you had already given her, you said that you think it already saved us $10,800, just those changes? I'm thinking that's what you said.
Can I ask something before you do? You said y'all had already changed some rates, the hospital stuff, and you had realized y'all were doing those wrong.
right, when a
And
previous
changed
employee,
those rates.
yes.
So that might have affected that 12,000 change some.
Okay.
But they have in their training helped them
Okay.
with some other things also after that point.
Okay.
Yeah.
Okay.
Am I correct in saying that y'all?
Yes.
They did
Okay.
That's
with some other things after that, so.
Judge, I'm not saying that they're not as good as far as screening who's eligible for indigent care. I'm just saying that you're gonna have issues with cost. And I think that those are just, I mean, if you go back to Red Book, I mean, I'll probably make out like a bandit on the one patient that I have. But, you know, if you're gonna pay $500 for something that costs $100 now, but I would stick with cost on that, and you know, I think you can negotiate that as well. So, also,
There might be some confusion because we didn't do pharmaceutical at all. We just talked about medical. So we
Yeah.
didn't do this pharmaceutical. We rely right now totally on hometown pharmacy, and if we use
And
Pharmacy
whatever their
Plus, we
cost
rely on
is.
what they're telling us that cost is.
And-
So we
and-
don't have no way
and
to
we-
check that.
We have counties who choose to use our software for the inpatient, the outpatient, the specialty care, the doctor visits, and not use our software for the pharmacy. It's kind of like the satellite radio I get in my Hertz rental car. There are 200 stations out there. I may only listen to 10 of them, so we're going to provide you with a lot of tools. And if you choose to not run the one prescription code for non-prisoners or prisoners through our software, that is a local decision. All I'm saying is, let's try it. I'm taking all the risk. And if it's not good for the community, no harm, no foul. I've never not had a county say, let's keep going.
How long do y'all for good for? If we don't decide today?
No. Well, if you table this and don't decide, the offer's on the table.
Okay.
The longer the county waits, the less free time it gets. Right now, given the installs that we have, I believe that we could install this in late April, probably first week of May. But if the county waits a couple more weeks or a month, then, you know, that may push that, therefore the trial period is less. Yeah, but when I leave here, my offer stays on the table.
Okay.
And with all due respect, I figured that if this is something the county wants to try, I'd go write a memorandum of understanding. Your county attorney would have to approve what I wrote. The court would have to act on that. So even if you made the vote to try this today, we still got some, you know, I got to put my free offer in writing, I guess is what I'm saying.
I have no problem with being it's no cost to the county. I think it would be a plus being that it's free to us. It's no cost to us, and at the end, if we decide that it's not saving us at all, it's not benefit for us, we can cut ties and move on down the road and go back to what we were doing. And I think.
Actually, we could continue to look at it from our side and see what y'all come up with as far as what the cost, you think the cost would be, and then we'll see what they have and see how much we really are saving. If we're really saving that much, well, then that would, difference there, well, then that would surely be. consider.
So would you like?
Do you want the table to think about it until next week, or do you want to decide to do it on a trial basis, no cost?
I have no problem with it. What do you got?
I like to table it for next week. Talk about it a little more.
To review all that information? All right, is that a motion?
Yes, ma'am.
I
Are
second.
you all right with that?
I'm okay with
Okay,
it.
all in favor, aye. We'll table it to next week and come back with,
Thank you, I appreciate the opportunity.
thank
If
you.
you have any questions, give us a call. Okay,
I appreciate you giving us the information too. It's been very educational.
thank you.
Thanks.
Good to meet you, thank you.
Item number 11 is to approve the Texas Department of Agricultural grant for senior services.
Or if you would wait till after court, I'd like to visit with you.
Yes, sir.
Judge Grant, she's not here, but that's her TDA. I did have the actual amount that, the
I don't have
resolution.
anything on that.
Okay, the resolution was approved in October for us to get the grant. And all this is doing is approving the grant. We received 8,000 and, well, half was 16,812.82, which is $8,200. We have received that. This is just y'all approving the grant.
To approve that.
I'll make that motion.
All in favor, aye. Motion carried. Item number 12 is to approve the resolution for tax pool.
Okay, then we met with tax pool, and when Kay left, and that just put me on there, and they said we have to have at least 2 authorized representatives to make any dealings with tax pool, as far as, you know, the resolution, or if we were going to go to a different pool. I provided y'all with some information that you can look at there. When he met with us, Clyde, and he stepped away, but he had showed an interest in wanting maybe to invest some money in tax pool. And so when we met with this gentleman, he was talking to us about the tax pool prime, which right now we just do tax pool and not the tax pool prime. The difference is commercial paper, and you'll see that on your little circles there. So there is a slight more risk, not a risk like in you're going to lose your money risk. There's a slight more risk in commercial paper than there is in the tax pool. Just does government entities. Meaning, now when I say that, don't get me wrong and think anybody can invest in tax pool. Tax pool is just a government. It's what paper they buy or what they invest their money in. And so on the tax pool only, they just invest in governmental things, and then on the tax pool prime, it's a higher rate of return because there is a slight more risk of what they're buying. They handle all that, so again, it would not be up to us. We would not be buying anything. We would just be putting our money in there. If y'all, there's 2 options you have today. We can either stick exactly like it is with tax pool and just amend the resolution to,
Add your name.
amend the resolution to add Karen as a rep, same as I, and then add Allison as a view only. Where before it was Kay and I as reps and Karen as a view only, or an honor. And but I felt like being on the investment committee, we both needed to be reps, and then we'll add Allison as a view only. Or you can do this one, which is adding the option of tax pool and tax pool prime, which you can have more than one pool. And then if someone wanted, and you can invest in either or at any time. And so then if, someone wanted to put theirs, have us transfer the money into the prime versus the regular pool, they could do that.
When you say someone, so if one of the commissioners wanted to invest, they could put theirs in the prime to get a higher rate, even though it has a.
That's correct, and it's still about the 2-day
But the
return.
county could stay in the regular tax
That's
pool at
correct,
the same time.
that's correct. However we want to do it, and you can do it both at the same time, you could put some here, some there, and it works, he said it worked absolutely the same as far as us putting in and getting back. It's about a day and a half to 2 days of getting our money, and it's still daily compounded, so.
But the commissioners would be, if they wanted to participate in it, we would set up a different account for each one of them,
But
so.
they could choose whether to use the other or not.
I mean,
If you you don't go with the resolution to do with the additional pull, the prime, then you can only do text pull. So,
Make a motion, we do vote.
and I have paperwork ready on both.
All in favor, aye. But for the county, we are probably gonna stay with the regular text bill, which has no risk.
Is a minimum a half a million?
There's no minimum.
Or is
There's
this
no
just
minimum.
for example?
Those are just examples, there's no minimum.
Item number 13 is to allow Lloyd Smith to opt out of the medical health coverage. And I know we have to keep a certain percentage, are we still good with that?
Yes, ma'am, we are still good with that. I do have his letter, I did not make copies of that due to reasons, but I do have his letter, and he does wish to opt out, and we're still good with that.
All right, are we, all in favor, aye?
Aye.
Any opposed? Are there any comments from Commissioners Court members?
I believe, was y'all having, getting ready for our fundraiser?
That's our shirt.
Oh, that's your church, okay.
I'd like to mention, John Daniel, that worked for me, passed away last Thursday. 10-year employee. He, 50 years old. Up in the air on the service. The family will probably have a private family type graveside at a later date. So keep the Daniel family in your prayers.
And if there's anything that we can do, Precinct 3 can do to assist you, we'll be more than happy to help you in any way we can.
Mr. Curtis Black passed away, and we have two of his children, Steve and
Teresa.
Janet's
Teresa,
Janet,
his wife.
Janet's
Teresa, his wife, is the, it's her father-in-law, and
Janet's is here.
Janet, yeah, I think Janet's name for a minute there, is another daughter of his, but he was a very well-respected man in the community also, and let's keep their family in our prayers. Anything else?
I want to thank you, Judge, for your help last week too. Appreciate you.
All right, if nothing else.
I got a question, kind of, says in this,
I don't think we can talk about this. Let's put it on the agenda. Would that be all right? I see what you have in your hand. There would be discussion, so, okay, I'll put it on the agenda. All right. Do you have a motion to adjourn?
I'll make it a motion.
second.
All in favor? Aye. Adjourn.